Welcome, everyone, and thank you for joining us today. I'm Katie Keating, and I lead our solutions engineering team here at Unite Us. As public sector leaders navigate a rapidly evolving policy environment, they're being asked to do more than ever. Strengthen program integrity, demonstrate accountability, and deliver meaningful outcomes for the communities they serve. These are not simple challenges, and they require both strategic leadership and best practice approaches to implementation. Today, I'm excited to be joined by Keith Gardner, our Senior Vice President of Regulatory and Government Affairs. Keith brings more than 2 decades of experience working across government and the private sector, including serving as Chief of Staff to the Governor of New Mexico. Throughout his career, he has helped shape policy, navigate regulatory change, and build partnerships that drive impact at the state and local levels. Today, we'll explore how leaders are thinking about program integrity in this changing landscape, the priorities emerging across the states, and what it takes to align oversight and compliance with meaningful community impact. Keith, thanks so much for joining us today.
Hey, thank you, Katie. Excited to be here.
Love it. All right, so let's set some table stakes maybe for everyone listening. So, program integrity means different things to different people. When you're talking with state leaders today, how is the conversation evolving beyond fraud prevention to broader questions about accountability and outcomes?
I think it's interesting, right? Because as you look across the political spectrum, left, right, center, wherever, people believe, I think most people, most rational people believe that those in need help and that we as a compassionate society and who we are a great giving society as Americans, have always found that those we should serve those in need. I think what's interesting is we're starting to see that a change in the expectation of what those needs being met and how those needs are met.
Mhm.
And really it's about real results for real people. And I think that's what the public is now demanding, saying we want to see actually results as a part of this. And so the conversation has evolved beyond just the fraud portion, which is a problem and has to be addressed. But really, then it goes into the waste and abuse of look, let's talk about what the outcomes are, not about outputs, but outcomes. Are we really giving the services at the appropriate place, the appropriate time, with the appropriate amount? Because these are finite resources. And if you do it the right way, you can help even more people.
I think that's really interesting. I think sometimes government is really focused on what happens inside of a building, but community is really about what happens for a person everywhere. And so I think some of the exciting conversation going on right now is if someone has a food need, for instance, are they applying for SNAP, but also are they going to a food bank? Are they, getting support from a family member with a meal on Sunday? And what does it really take to serve somebody and make sure that they are getting to that place of self-sufficiency while also making sure that that safety net is there for them?
Yeah, it's funny that we want to do a one size fits all sometimes in this space as well, because government likes that, right? If you can fit it into a nice, clean, tight box. But the truth is, just like all of us have specific needs,
Mhm.
so do the individuals that are in need. And so it's having that flexibility, but yet attaching accountability on the backside of that flexibility. Because again, these resources are finite and you want to help as many people as we possibly can.
Absolutely. Um, so in today's landscape, there's a lot going on, of course. There's new federal policies, there's increased expectations around everything from Medicaid community engagement to rural health initiatives. What do you think the biggest questions leaders are asking as they think about oversight in this environment?
I think the high level leaders, the folks who are, at the top of this, if you want to say food chain or wherever, are really trying to figure out, okay, we have this influx, especially with rural health
Mhm.
specifically, but in other areas, there's an influx of dollars coming into the system. How do we take those dollars and make sure they're spent in a way that doesn't increase this ripple effect that we see sometimes with these programs, that the unintended consequences of adding to the siloing within agencies that we see so often in government, or adding to the fragmentation, as we call it, of just not systems not communicating. You solve for X, but then you hurt Y and Z. And
Mhm.
I think that's the biggest question. A lot of leaders are saying, okay, we have this coming to us. There's these changes going on. How can you use this as an opportunity to solve well beyond our own tenure. Most of the folks who are in the chair today won't actually see the true effect of all this. And so it's putting aside the politically expedient for longer term. The way to do that is data, right?
Yeah.
Isn't it crazy that in government we collect all this data? Like we're constantly consuming and pulling data. Government, you see that, but then it's like, well, what are we doing with that? If you ask some of the leaders, you'll go through one of their intake forms and go, okay, well, where does line 16? What is done with line 16? A lot of times, like, I don't know. It was there 2 years ago, so we just kept it. And so we collect a lot of data, and we need to do something with that data to better improve and further these programs, make sure there's integrity in the program, make sure the right people get served.
I love that policy focuses on data because as a technologist, I also think of data as my problem. And so when we have a shared language, I think it goes far in helping, understand what's actually happening. I think the question about where does that data go is really interesting. I think for so long, data was really focused on who is the person I have to report up to, either at the state
Right.
level or what does my federal oversight body require of me, as opposed to if I am looking at a SNAP program that reports up to USDA and Medicaid, which reports up to CMS, right? But I have the same inf person that I'm serving. What does that data look like when I can just start to look at that person level as opposed to the program I'm reporting on?
Yeah, and it's crazy, right? Because when you look at these budgets, and budgets are tight always, and it doesn't matter how good or bad things are going in the economy, budgets seem to always be tight.
Yeah.
And so you're having to make priority-based decisions on, okay, if we put X dollars here, what is the real impact? And most states have a pretty defined base budget. You got to pay for police, you got to pay for fire, you got to pay
Uh-huh.
for incarceration, you got to pay for all these different things, right? So you take these other resources that are finite and you say, okay, if we leverage here a few extra dollars, what does that ROI look like? One, what's the impact to the individuals? Because that should be first and foremost. But then
Mhm.
how can we use that to leverage those dollars to do additional savings? Do we front load that saves us money on the back end that we can then leverage? You can't make those decisions without
Mhm.
data. And I remember back in my days in the legislature and as chief of staff, sometimes we were just hoping. Like we didn't have the data set, so you would just go, yeah, maybe if we do it here, we think this will go. And sometimes we got it right, and sometimes we got it wrong. And I think we're at a place now in 2026 where we have so much more information we could use to leverage to do that. I think that's what states, but that's not comfortable for government completely. It's kind
No.
of a new space for them, and so yeah, it's exciting. I think that's what's so cool about this.
I love that. I hope we've come further than throwing darts at things, but sometimes that
Yeah,
is just, you need to pick a place to start.
right,
I
right.
love also you talking about outcomes and ROI because I think sometimes when people think about government and you think about, whether it's a technology system or, a new fire truck, what is the return on investment? And I think sometimes folks think about public sector spending as just like there's cash and you spend it. But as you said, if we're trying to serve more people, if we're trying to get to a different place that really moves the needle, you have to think about like, what is the effective and efficient way to spend that money?
Yeah, they're not infinite dollars, right? And that's, I think, the realization that they're not infinite, and you have to start to look at it more. I don't like. I mean, you hear a lot government as a business. This is a little bit different. We're talking about humans here, and we really have to start looking at, but we have to look at it as outcomes. We have to
Mhm.
stop focusing. Government likes big numbers of saying we did these things. We interacted with 25 people. That's wonderful. But if 24 of those did nothing with the interaction, yeah, it's incredible for that one. But how do we leverage what we got with that one for the other 24? It's about outcomes. Like until we change our mindset to saying we don't care about the as much about the output, we care about what the outcomes of that, we're going to continue to see the potential actually for some of this waste and fraud.
Yeah. When you think about um, that outcome and you think about that 1 versus 24, how do agencies strike that right balance between thinking about how do you strengthen oversight, but also maintaining access to services for the people who need them? Like how do you help people figure that out?
I always got that. That's kind of the yin and yang, right? In an agency, you've got the 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 good news is we have incredible people in the field in a lot of these agencies who care greatly about human beings, right? Not that others don't, but they're really focused on that. And that gets balanced with sometimes what, some people call, I know the accountants don't like being called bean counters, but right. But the accounting teams and that balance has to be struck. I think that it goes back to the simple issue of, you've talked about this before. I've had this conversation a lot, Katie, that it's integrity, program integrity really is about that, striking that balance between the two, saying we know people in need have additional issues or struggles, and looking at how we can help them get through or navigate this process. I think that's the part that starts to strike when we talk about these individuals individually, as
Mhm.
opposed to somehow everybody who's hungry fits into this box, and everybody who's homeless fits into that box, and who everybody who's lonely fits into that box, right? The
Yeah.
truth is they fit into a lot of different boxes, and really overseeing that system, again, using the data to look at what's happening on an
Mhm.
outcome basis. Because candidly, I could make outputs. I mean, we can do those all day long, right? I can
Yeah.
go out and I can fudge the numbers. I've done it before in
Mhm.
my previous life and other things. You just have a way of doing that, but you can't fudge outcomes. You just can't do it. And I
Yeah.
think that's the important part.
I love the focus on the individual being served. I also think about caseworkers a lot because I have been doing a lot of, technology system integrations at the time where policy is changing and you have to think about all of the rules it affects, all of the things that have come before. Policy documents are littered with refer back to this earlier thing.
Right.
I think it's one of the great opportunities for tools like AI, because if you are a caseworker who is trying to talk to someone and have this really person-centered discussion, they might have kids running around in the office with them, right? You have a lot going on in limited time to help. How can you, get a check on what was the policy at the time? What is the policy now? If you're going to make a change in their circumstances, what else is that going to affect? How can you have that conversation with them? Um, and I think that that really, creates that nice balance there as well between the person being served and the person who is often feeling like overwhelmed, overtaxed, or not supported enough to have a conversation that is really balanced around that.
Yeah.
Um, I think it gets a lot to how do you help that staff member take the next best action for someone? We know, especially for families with complex needs, that it can be hard to know where to start. Also, if like you're a new caseworker and you are, just getting into this, you don't necessarily have 30 years of experience. So how can, you prompt folks with sort of tips and tricks for like where to go next?
And I think again it goes back to that data conversation we were having earlier. What happens too often, data gets reported up,
Hmm.
it doesn't get reported down, and it doesn't get reported across.
Yeah.
And when they learn, I mean, nothing is more motivating than success.
Yeah.
And you
It feels
watch
great.
it does. Well, we
Yeah.
all, right? All, it doesn't matter how much you have. It's
Yeah.
it's but it's just it's probably one of the good addictions, right, in life. It
Yeah.
doesn't matter how much you have, you want a little bit more. So yeah.
That is a great lead into the next question, which is that if we think about public programs that are different, delivered across different offices, different organizations, different sectors, and how we relate this to the idea of program integrity, how do you think about that in the challenges around visibility, accountability, and how you can better coordinate?
I mean, one of the biggest challenges I always saw, at least in my tenure in government, both legislatively and in the governor's office, and I saw it in when I managed physical therapy clinics. Same problem, right? Was fragmentation within the system.
Yeah.
Here we are in 2026. I can be on any named computer operating system and go to the internet and right have that interaction. But yet, when it when I have to go to my three different providers for medical records, none of them talk to each other, whatever. It's crazy to me. And so I think this fragmentation that we see, that's why we see in social care was the one attraction. There's a lot of attractions to Unite Us when I came over a year and a half ago. Um, Mainly the mission of what we do. I just love our mission, but a part of that mission is getting rid of fragmentation, right? How do we unify? And when you see all these competing systems, how do we start to have a single set where the data looks the same, where it can be evaluated, it's clean, it's usable. And I think that that's where we're going to start seeing when the health systems communicate with the community benefit organizations, communicate with the different agencies. As you know, government is the worst about interagency communication. It was
Mhm.
crazy to me. I mean, we're in a state of 2 million people where I was chief, and we had, 23 cabinet secretaries at one point. I had more later, but and you're like, do you guys ever talk? Does anybody ever talk? Do your systems ever talk to the lower? Because they don't, and everybody's in their own little world and going. So I think that's the biggest risk we have. Sorry, long-winded
Yeah.
there. Sorry.
Don't be sorry. Prior to coming to Unite Us, I was working on a lot of projects with government around bringing together um, this record of a person across systems. It was one of the things that really impressed me about Unite Us was instead of trying to bring all of that together, we foundationally start from a single longitudinal record for a person. So between your health systems, you can share one screening, but between two government agencies as well, you can share what is being worked on for that family to understand, um, are they receiving other services? You can send a chat message without having to try and dig through four other systems to find that person's email address, if you can even find it. And being able to understand sort of what someone received, when they received it. Have they applied for SNAP four times before? And, the process always falls apart at the interview, or is it something else that is the issue? And I think that goes a long way when we think about accountability and understanding sort of what has happened before, but also what do we need to have happen to get to the outcomes that we're looking for.
I mean, when you talk about that longitudinal record, we start to talk about truly closing the loop in these referrals
Mhm.
rather than this notion of somehow you're hungry. Oh, here's three food pantries. I wish you well. Pat them on
Yeah.
the back and send them. The idea that we can actually say, okay, they went, they received, and we saw them receiving over a period of time, but then that stopped. And then they're back in the system 6 months later. Like what happened during that 6 months? Like having that longitudinal record you refer to, where we can have historicals and pull in, you can
Mhm.
do so much more with. And if you've ever been through, from my personal history as a child, as you in a family that struggles, you go through ebbs and flows. There's highs and lows.
Yeah.
This isn't a magic wand, boom, they're done. And we wish we could help people that way. But the truth is we get so much more of a picture from that longitudinal record rather than saying, oh, they were referred out. We just don't know what happened. That
Yeah.
doesn't do us any good.
No, and I love that you brought up the closed loop because even though we talk about it as a way to ensure connections to care and that people aren't falling through the cracks, it's also accountability. It is an
100%.
auditable understanding of I sent this referral, it was accepted by this organization on this date. This is what happened. And I think Keith, to your point too, on the ebbs and flows, when people come back to us, it allows us to look back at what was successful last time. Instead of trying three other things or throwing a dart at the wall, let's start from what worked last time. Let's get you reconnected to that person you already trust. Let's get you reconnected to the organization you've already been successful with and go from there.
And on the audit and compliance side from the state, they
Mhm.
also have an actual real record of what happened versus trying to piece together. I think that's an important part on integrity. We've got to give them what they need to
Mhm.
give the data, well, because there are issues, I should say, around integrity. We need to give them the data they need to be able to enforce and do what's right by the taxpayers as well. it,
Yeah.
it solves a lot of issues.
It does. It reminds me too that prior to Night Us, I worked with a lot of programs that were serving teenagers who, of course, love to text. But that is not auditable in a system anywhere. And so being able to have that audit trail of the communication that happened as well, then it goes right back to, exactly what happened.
Exactly. Yeah, I love it.
Yeah. So we know that technology isn't the whole answer, just like policy is not the whole answer.
Uh-huh.
But when you're thinking about how to strengthen program integrity, what do you encourage leaders to look for?
I'm looking for the systems that give them the tools they need to do it. We're not the enforcement folks, and candidly, others who say they can do that, I don't think there is a system put into place to do enforcement. We should be on the side of really helping folks, but providing the data to the state they need of what really is going on the ground. That's the partnership here, and I think that's what's important as you hear people talking in this space. It was always frustrating to me when you get sold this, we can do this, and then you realize, yeah, you're doing part of it, but you're not doing it all. I was so excited about the closed loop, and I learned more of it. I think I told our CEO, Taylor Justice, I was like, dude, I would have given my left arm,
Yeah.
candidly, to have the data set that is given today
Mhm.
of back when I was having to make those decisions and advising my boss on where to go, because this information, leaders are begging for this kind of stuff. There's always in the market, you'll hear a lot of chatter, right? And so it's important that they really look at what is a true full wrap solution for social care. Having the data, not only who's in need, that they've been sent somewhere for need, but what the outcome of that need was. And did we change that? And that's why we see great results in certain states where you're seeing ROIs of over $150 per member per month. I mean, it's insane, the ROIs, but it's because you just take that data, you don't depersonalize what you're doing, but you
Mhm.
take the personal component, merge it with the data, and you can change people's stars. And candidly, that's what I wake up every morning to do. Let's just change a star or two. Make
I
somebody's
mean,
life better.
it is a good way to think about the day.
Yeah.
Um, and I love that because it's wild that the numbers are so great. But it is that ability to take that data out and combine it with people's medical information to understand services that were paid for, how investing a little bit upfront in paying for a food box means that people don't go back to the emergency department. They don't, inappropriately use the ED as primary care if they know who to go to for help. Um, and that's amazing that combining that data allows them to see the kind of impact that's happening. All right. So, in the interest of time, we're getting near to the end of our time here, unfortunately. But um, I know you spend a lot of time out traveling, talking to state leaders. Medicaid directors are my favorite right now. But as you're out talking to them, what's one thing you'd encourage them to prioritize over in the next 12 months?
I think it's really, for me, it's interesting to have those conversations because we are in such a reactive, especially with some of the things going on in the country. You'll see where there's been investigation, whatever. So a lot of states tend to react in
Mhm.
that environment. And it's shifting that from a leadership perspective of saying, okay, we understand there may even be some of these states may even be dealing with some of those issues, but
Mhm.
changing from that reactive oversight to a proactive management and
Mhm.
finding the tools that mesh well with what they do. How do we how do we get rid of this information lag? How do we really, especially in healthcare, right? We'll see a lot of proactive work in other agencies, but healthcare tends to be a little bit behind what other do for some reason. And so, and social care tends to sit in that same area. And so really looking at leveraging the technology, my advice is leverage the technology to become a proactive manager as opposed to a reactive um, fixer. It's a hell of a lot less stressful, I can tell you. And watching the change you can see in your system, where you don't become the agency that comes in is always asking for extra money, right? Where you
Yeah.
can actually go, hey, we're doing good this quarter. Governor, thank you. So yeah, shocking, right? It'll make your chief of staff very happy, I can tell you.
I love that. I always think about when I first learned about how there were whole divisions related to going out and pulling back money from Medicaid fraud. And I think an important part about implementing new policy is really designing for what you want to have happen. So making program design one of the things, or sorry, program integrity, part of your program design work, right? Right up front what are the guardrails you're going to build in? What are the tools you're going to give people to ensure that happens? All the way down to, I really love when government focuses on the resident experience, right? For so long, I think it was really an afterthought. We were worried about implementing policy, eligibility systems, sometimes caseworkers if we were lucky. But improving that resident experience as well can make it easier for people to get help. They might only have to come see you once. You don't have to match data across systems if, they got all the way through the first time. And being able to make it clear to them, like, what the expectations are, like guiding people throughout the way. I mean, we joke here all the time that the word you're looking for when you're looking for a resource is not the word government calls it, right? So we need to be able to take language they use, provide it in a language you speak at home if that's what's required. But I think that that is not counter to designing with, program integrity up front too. They really complement and get to the same goals that are not competing, but can really reinforce one another, I think.
And I think the fragmentation issue we talked about has a huge effect on program integrity, right?
Yeah.
If you don't have fragmentation, you have more light, and with light, there's less fraud, there's less other issues that come in. The other part of it is the ease of getting in and out of the system makes a huge difference on whether or not people feel like they can defraud it. If you believe it or not, it's counterintuitive at times, but if you make it easier to get in and out of the system,
Hmm.
there's less risk to the system for fraud, waste, and abuse. And I think about it as someone like me who doesn't read instructions, right? I put on my man hat when I go to build something. And if halfway through I have to take it second apart, blah, 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 blah.
Hmm.
There's easier to make mistakes. When I've taken and the system is simplified and easier to understand, there's less risk of somebody from the outside trying to take advantage of that complex system. Because that's usually where these
Yeah.
folks who do that, they usually take complex systems, take advantage of those complex systems so that they can do that. When it's simple, it's a lot harder to do. So I think program integrity, as you said, has to be from the word go. You have to think about that of what you're building in as you go. I think it's a great point.
Amazing. Keith, thank you so much for spending your lunchtime with me today.
Love
Um,
saying it.
and thank you all for joining us.